From the News Channel 5 Network, this is MorningLine.
Good morning, everyone. Thanks for joining us on MorningLine. I am Nick Barris. It's Wednesday, and we have a good show for you this morning, a health-related program. We're going to be talking about your eye care, eye health. I keep having to upgrade my glasses because every couple of years my eyes keep getting worse. It's like a switch went off in my head when I turned 40. Click. And all my life up until that point, my eyes were fine, didn't need contacts or glasses. I know many of my friends did, but then all of a sudden, poop, my eyes reading closer. If there's not good light, glasses make a difference. What is it about that? What can you do about it? And there's a lot of other things we can go into this morning. If you have issues with your eyes, if you want to give us a call, because we have an optometrist on the show who can answer all kinds of questions about what I consider to be one of the more cool parts of the human body, the eye. Just think about it. With us this morning's Nichole Rudowski. Good morning to you, Nichole.
Good morning.
It's nice to have you with us.
Good to be here.
An optometrist. You had to go to school for that.
Yes,
Am I
very
right?
long time.
A very long time.
Yes.
I was asking her if she ever held an eyeball in her hand. Okay, that's just a weird question, but I wanted to ask that. I mean, you're not a surgeon, but you're an optometrist. You said you had to do some things like with some animal eyeballs and stuff like that, right?
Yes.
I mean, it just comes into the standard training and that. But the eyeball itself, just to me, is probably about the most fascinating part next to the brain of our entire body. Would you agree?
I would.
Do you ever look at it and think about it and you study it? And how the heck does that work?
Absolutely. My eyes are amazing.
Yes. I mean, and they, I don't know, do we take good enough care of our eyes? Do you think the average individual, if you're lucky enough not to have problems with it, I tend to, if I don't have an issue, just leave them alone. But I know sometimes maybe I'm not wearing sunglasses and the glare hits me more than I should, or I rub them too much when I have allergies. Does the average American do what they need to maintain their eye health?
I would say no.
What is it we do wrong?
The majority of my patients are guilty of not wearing sunglasses enough. Most of my patients tell me they only wear sunglasses during the summertime, and that's not a good thing. Sun's out all year long. You can get that UV light damage all year long. Things like cataracts, macular degeneration, all those things can be caused by not wearing sunglasses. So sunglasses are huge. You know, a lot of people, like you said, rub your eyes too much, have a lot of problems there with allergies, and those are easy things to treat. I think a lot of people are like you, that if we don't feel like we have a problem, we don't get our eyes addressed, but there's so many different diseases that can show up in the eye, and unless you actually go in and try to get treatment for it, or even just get yearly screenings for things, you don't know you have a lot of conditions unless you get checked.
Yeah, that's the point. Some of the degradation of your vision can happen so slowly.
Absolutely.
That you don't really notice it, and when it finally is addressed because you go somewhere and you have to take an eye test and they're like, boy, you can't even read that bottom line, what's wrong with you? Then you realize it, and then they correct it and you get your glasses or the treatment, and you're like, wow, I've been missing this all this time. So you may not know. So you're saying, I think most of us, up to a certain age, obviously, if we can, go to a general practitioner once a year for our basic physical. And that includes, they'll look in my eye, but they don't do much more beyond that. Is that sometimes enough to determine if there's something wrong, if I haven't noticed anything? Or do you really think you need to go to an eye doctor? And at what age should you start doing it? Every year, every 2 years? What do you think?
Sure. Usually what I recommend is for kids to start getting checked, usually before they start kindergarten. And obviously there's a big family history of nearsightedness or farsightedness, lazy eye. We ask them to get checked earlier, but definitely before they start kindergarten, and then just get yearly eye exams from there. The pediatricians do a good job with screenings and things like that, but there's some things that aren't picked up with the screenings, so it's just good to get it checked out. And vision can affect kids so much with learning. A lot of kids are very hyperactive and they don't concentrate at school, and a lot of it's because they can't see the board.
Right.
And a lot of times when they get their glasses, it's amazing how much more they can concentrate because they can actually see.
Can you imagine? Well, I was asking her, how are things going? I hadn't seen her in a few weeks, and she said, well, it's busy right now because it's back to school. And you're just basically like, after the summer months, parents are saying to themselves, let's just go in for that very reason. Is this just to maintain, to see if the glasses are needing to be updated, or what are you checking on? What's happening this time that's so busy?
Absolutely. A lot of it for a couple different reasons. With your eyes, again, it's a very important part of learning. So a lot of kids, their vision can change on whether they wear glasses or not. It is so gradual. They don't know that there's been a change. I have kids come in every year, say their glasses are perfect when they come in. and they're 20/40, 20/50, sometimes worse, and they don't realize their vision's changed. So a lot of parents are trying to get kids in so they don't have to miss school to get their eye exams, but to get them checked right before school starts just to make sure their vision's where it needs to be so that it doesn't affect the learning at all.
You know, I don't even know, do public schools these days still do eye and ear exams at school, to your knowledge? I mean, I remember as a child having that done. I can't think if my son has ever had that where, you know, they just do the basics so they can check. Do you know?
I know they do it. I don't know if it's every grade. I think it's just certain grades they'll do it.
Yeah,
I know we live in
school.
Rutherford County and work in Rutherford County, and I know at least there they do vision screens. I have kids come in all the time. The parents bring the slip showing that they failed the vision screening, and so we'll go over that. So I know they still do some hearing and vision, but I don't think it's every year. I think it's just maybe every few years they'll do that.
I think it's a great idea because not everyone checks it, and that was a way to have it done to alert parents if they hadn't noticed it at that point. So right now, busy time for kids going back to school, getting their eyes straight. Now, when you deal with, as an optometrist, do you also deal with things regarding the eye, you know, lid or the area around the eye, or is that more a dermatologist or something like that? I'm just curious.
Yeah, if it's anything that needs to be removed.
Well, you hear like styes in the eye.
Yeah, and that's definitely things we can treat at our office.
Sty, all right, yeah, it's interesting. It's my wife actually on her upper eyelid recently. I don't know if you can have an infected hair follicle, but there's an area there that's gotten more red or irritated. And you wonder, all right, you know, you always talk about, you go online, put a warm compress on, see if it eventually drains or comes out. If not, then what is that usually related to? I know there's pink eye and other things, but what can cause styes? Another phrase, is it something called celiac or something that's
Chalazion? Yeah.
What is that?
It's just a fancy name for the scar tissue left over after the sty forms. An active sty is a hordeolum, and then the chalazion's the scar tissue left over afterwards.
And sometimes that's just there. It's not going to be as irritating, but it's a bump, and that sometimes has to be surgically removed.
It can be, yeah. They can inject it with a steroid, or they can actually remove it surgically.
But that's after the sty.
Correct.
And what essentially is a sty, technically? What can cause a sty?
Sure. One of the biggest things that cause it, the most common one, is what we call an external hordeolum, where you actually, there's glands that go right behind your lashes that produce an oil that goes under your tears, and a lot of times that gland can get clogged, and that's the one you see where people actually have like the little white bump on it and everything. Best thing you can do to get rid of them are those warm compresses like you talked about.
Try
we can give antibiotics, and usually if we do antibiotic, it has to be an ointment, but even with that, if you just do the antibiotic ointment, sometimes we'll give you a steroid with it too, just to try to bring the inflammation down. But those warm compresses, you know, 5-6 times a day, as many times a day as you can. Obviously don't scald yourself, don't heat it up in the microwave or anything like that, but just underneath some warm tap water and just hold it over it, massage it. It helps to open up that gland to get rid of all that infection out of it. Because if you don't do that, that's when a lot of times the chalazions will end up forming and you get the scar tissue. And the only thing they can do to get rid of them, like I said, is either inject them with a steroid or cut them out. And most people want to prevent that. I prefer my patients to prevent that. So if we can do the warm compresses early on, that really helps out a lot.
Basically, that kind of home remedy, you stick with it. Most of the time, they can resolve themselves. But boy, they're annoying.
They are, and they can be pretty painful.
Have you seen much pink eye of late at all? And I guess that'll kick in once school starts.
Yeah, usually when school starts is when we start seeing more pink eye.
And is that a virus? What is that?
It can be. There's a couple different types of conjunctivitis.
Super contagious,
It absolutely can be. There is bacterial conjunctivitis, viral conjunctivitis, and you can even get allergic conjunctivitis, which is obviously not an infection. It's just more that inflammation from your allergies. The most contagious one is the viral infection. With that one, we pretty much just have to have you stay away from other kids and other people, make sure you keep your hands clean. With bacterial conjunctivitis, you still have to be away from people for about 24 hours after you start the antibiotics for the most part, but that one we can actually treat. With the viral one, you just kind of have to let it run its course on that one. And usually when school starts back is when we start seeing a big surge of that.
It kicks in. All right, listen, we're going to take a break and we'll open up the phone line, 737-7587 if you want to jump in. You know, I've just touched on a few topics that maybe, you know, are of interest. Of course, there's a lot more. I want to talk to you about some of the new things that are being done, what other situations you deal with adults as well. So the primary questions there. Glasses, you know, whether or not really using Visine to get the red out is a good idea. We've talked about that before. We'll get into all of that. And if you have questions about your eye care, eye health, this beats an in-office consultation because she's right here. And we'll talk to her more right after this. Stay with us.